We really get our patients from all over. I mean, we get them from GPs. I mean, a lot of them are direct-to-patient marketing kind of thing. You know, a lot of patients have been told, oh, your implants are going south. Oh, well, what do I do about it? Well, they find us, and then we're actually able to rehabilitate a lot of those.
It's always this gloss over, right? It's kind of like, here's how to do full arch, or here's how to do the marketing, or here's how to do the sales. Let's go. And then it's like, oh yeah, and some of them might fail, and this is, kind of, it's like this side thought, afterthought. But I have a feeling that it's a lot bigger than that.
It's one of those things. There's success and then there's survival. You don't just want your prosthesis and your implants to survive, you want it to be a successful case. And if you see the differences between success and survival, well, it's...
Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the founder of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. But you can't grow if you have a bunch of angry patients because your implants are failing. And today, I have Dr. Mark out of Florida, who has built his whole practice around failing implants. And you're going to be shocked at what he has to say about these kinds of patients that are coming in to find him, to have them restore the implants that other people either did the wrong thing, or the patients weren't taking care of them, or even worse, patients went to other countries to get the work done. You're not going to want to miss this episode. Stay tuned. Could you just quickly tell us a little bit about yourself, and then tell us about the patients that you're seeing in your office that are helping you guys grow? It's kind of unfortunate that this is the case, but that's kind of where the world is at this current state. So feel free to share a little bit about that.
All right. Well, I am Dr. Mark McCawley, periodontist out of Fort Lauderdale, Florida. I mean, board certified periodontics and dental implants. And I mean, I place lots of implants. I've done lots of full arch, but in all honesty, my biggest growth avenue right now is treating failing implants. It's definitely it's a bigger avenue right now because there's not a whole lot of guys that can do it very well. And when these big cases start going south, you better know what you're doing because it can get ugly real fast. And that's the last thing you want, is to place a beautiful case, have it look really, really good. And then all of a sudden, a few months or even a few years later, it starts going south. And then you better know what to do. And ideally, I mean, prevent it. Prevention, an ounce of prevention is worth a pound of cure, especially when it comes to implants there.
Yeah. So what's the biggest thing that's causing implants to fail? Like, are these just implant patients that are kind of coming from everywhere? Or is it a lot of GP practices that you're seeing this from, where it's like, it was maybe their first case or second case, or are they coming from, where are these patients coming from that you're getting in and their implants are starting to fail? And then secondly, how long ago were they placed? Like, where are you seeing the time frame where they're starting to break down?
So, I mean, we really get our patients from all over. I mean, we get them from GPs. We get them. I mean, a lot of them are direct-to-patient marketing kind of thing. A lot of patients have been told, oh, your implants are going south. Oh, well, what do I do about it? Well, they find us, and then we're actually able to rehabilitate a lot of those. So, it's not necessarily GPs doing their first, second, third case. Sometimes it's just, these cases go south. Even the best surgeon, without any maintenance or without the correct maintenance, you're likely to have a bad time with these cases. And it's one of those things where normally, obviously, if an implant fails, it fails within the first couple months. That's an early failure. But it's the late failures that we're really seeing a lot of, and those, it's years. I mean, we're talking 3, 4, 5 years, and then all of a sudden, you see significant bone loss on these implants, and you got to know how to manage that sort of thing. And a lot of it is it's maintenance. There's placement, of course. You place the implants too close together. You place it in a non-restorable area. I've seen a lot of that too. But a lot of it's maintenance. These hybrid cases, they're thick. These patients weren't doing a great job of cleaning their teeth to begin with. And then all of a sudden you put this giant, thick monstrosity in their mouth, and you tell them, oh yeah, just, clean underneath it. Yeah. How are they going to do that? A lot of times they don't. And then that's how they end up seeing me.
Hey, I got a public service announcement for you real quick, and then we'll get back to the show. So the number one thing that people struggle with when they do full arch is that they can't sell the cases, no matter what the marketing does, no matter how good the dentist is, no matter how smooth your process is. Everything is about sales inside of the office. And if you want to close more, you have to learn how to sell full arch. And it's very, very specialized, and it's different than anything else in the dental industry. I had the opportunity to go in and use Stacy's playbook with our clients, and our clients have doubled their full arch sales with this course. And it's been amazing. Now, Stacy sells 60 arches every single month all by herself, and she closes at 75%, which most people average around 20 to 30%. So she is double better, if not triple better than almost everybody else in the dental industry. And here's the best part of it all. She recorded her whole process from end to end and broke it into 4 different modulars. And she's going to give you her whole playbook. And for our clients, she's going to give you $2,000 off. All you have to do is go visit fullarchsalesacademy.com and put in the code 2K Full Arch. Again, that's 2K Full Arch, and you'll get $2,000 off. Go check it out. I promise you it'll be worth it. And back to the show. So how much is on the patient versus the doctor? Like in your experience, so if you're seeing 100 patients and they have failing implants, how many of those patients are like, you know what, the doctor didn't really do what they were supposed to do in this situation versus, you know, the doctor probably did what they were supposed to do, but the patient didn't take care of the implants?
I mean, it's hard to really say, but as far as the doctors there, it's, you know, a lot of it is, it's a lot of prosthetic failures there too that can lead to implant failures down the road. You see these things with massive cantilevers and, well, the distal implants failing, or you see it loosened up and the patient didn't know any better, and then all of a sudden it wobbles some of the implants loose. You've got the doctors, again, making the prostheses where it is uncleansable. If I can't get down there to probe, how is a patient going to get down there to floss or proxy brush or use a water pick? It's impossible. So, you know, you want to set your patients up for success and not for failure here. And a lot of it is prosthetic design. It's, you know, surgical placement as well. If you place them outside of the bone or with very thin facial plate, well, a few years later, that facial plate is going to be gone. And, well, that you see a lot of issues with that too. You see the bone stripping out, you see implants being exposed, and it hurts and patients don't like it. And yeah, it's just, it's a whole thing. So it's hard to really pinpoint what's, you know, I wish I could say 50-50, but part of it's, at the end of the day, these patients don't know what they're getting into. So it's all on us as the dentists to tell them what to do to maintain them. And if we're not doing that, if we're not helping these patients to maintain them, then you're setting them up for failure. And, you know, you don't want to do that, especially with these big, you know, high dollar cases. You know, if it fails a few years later, trust me, the patient's not going to be happy about that. And they're, you know, regardless of whether it's their fault or your fault, well, guess what the patient thinks? It's your fault. So,
it's your fault.
Yeah, it doesn't matter. At the end of the day, it doesn't matter. You want your cases to work, and, you know, you really just want to help them out as much as possible.
Do we know, is there any data out there that tells us like how many of these cases are actually failing? Because, you know, it's always like you and I were talking about before the show. It's like, it's always this gloss over, right? It's kind of like, here's how to do full arch, or here's how to do the marketing, or here's how to do the sales. Let's go. And then it's like, oh yeah, and some of them might fail. And this is, you know, kind of, it's like this side thought afterthought. But I have a feeling that it's a lot bigger than that. Like, what do you have any thoughts or ideas around that?
I mean, I'm sure there's data out there that kind of show the failure, but it's one of those things. There's success and then there's survival. You know, you don't just want your prostheses and your implants to survive. You want it to be a successful case. And if you see the differences between success and survival, well, it's there. A lot of times you'll see a discrepancy there. You know, it's like survival's like 90% or something like that after so many years. And then, you know, when it comes to success, it's like 60%. You're like, well, that's actually a pretty big differential right there. And it's because, well, what's still in your mouth may not be, you know, aesthetically pleasing. It may not be, you know, functional. You know, if you lose some distal implants, have to cut off half the prosthesis. Well, you know, technically it's survived, but it's not looking good. And trust me, the patient's not happy with that. So, it's a fair amount, because again, these are things that aren't super cleansable, and they've been around a while, but not that long. So more and more are getting placed each year, and so we're going to see more and more of these failing each year.
Yeah, that's a good point. Yeah, as it grows, you're going to see more people failing. Even if doctors are getting better at their particular craft, they're just dealing with larger quantities, and that creates like a whole sub-market, to your point. Do you think that with technology and things like that this is going to help solve it, or is this a different problem that clinicians are facing?
I mean, I'd like to think technology would help out. But at the end of the day, technology can only help so much. It really is on the clinician, both the surgeon and the restorative. A lot of these smile in a day, or these smile in a box type things. Yeah, I mean they may work all right, but again, it's hard to say how those are going to work long term, especially considering I see them and they don't look a whole lot different, from a cleansability standpoint than one done a more traditional manner, unguided and just with impressions and such. I think guides definitely help out an inexperienced clinician, but I mean, I was at a full arch conference 2 weeks ago, and I was talking to a guy, and he does a lot of these. He said he did 9 arches in one day, and I was like, that's just incredible. And he doesn't use a guide, so who am I to say he's doing it any better or worse than someone who uses a guide? But it's tough to imagine the kind of volume that some of these guys are pumping out to have each implant in the perfect position and have it everything restored perfectly where it's cleansable, where they can actually get, proxy brushes and water picks up underneath the prostheses to actually clean it. And not only have they been trained appropriately to do so. And, I mean, a lot of success in these cases, from a periodontal point of view, it's patient compliance. It's the same thing. If I treat a natural tooth, periodontally, and the patient doesn't take care of it, well, it's a crapshoot whether or not it's going to work. Well, it's the same thing with a lot of these cases long term. Wow.
Yeah, that's a great point. I have so many different thoughts racing through my head around this right now. Let's go down this road. So if a patient goes out there and says, okay, I want full arch, let's say 3 years ago, they went in, they got it, the full arch, they paid $25,000 to fix their bottom teeth, and they were happy at first, but now they're having all these complications. What are they going to pay now to get things fixed and cleaned up?
I mean, it all depends on the case. Is it like
starting over again, basically?
I mean, it's not like starting over again. It's not that expensive. It's definitely, I mean, same thing with teeth. It's always cheaper or less expensive to save your teeth and save your implants than it is to start from scratch. But yeah, I mean, they may be out, $10,000. It's not an inconsequential fee if you're talking about, disinfecting whole arches of implants. I mean, if this is, full mouth is usually something give or take. I don't want to quote anything directly because every case is unique. So, but if you have to do that, bone graft some of these, do some soft tissue grafting too, because implants like having good soft tissue around them. They like having keratinized tissue. If they don't have that, well, they're going to be more prone to breaking down. And especially if you're doing full arch, a lot of these guys, they just cut away all of that keratinized tissue and, well, it doesn't grow back. So you don't have any keratinized tissue around these implants, and then they start to break down. They hurt too, especially if you get any type of facial bone loss. Literally, if you have like an aggressively threaded implant, like a Nobel Active or something, and you've got no attached gingiva around it, well, that's moving around. Imagine your gums constantly rubbing against a thread of an implant. That hurts. And I've seen lots of that. So, you got to take all these things into consideration when you're placing these implants to begin with. And, especially if you're going to be trying to rehabilitate these, because it's, there's all sorts of different things that need to be done to get these patients healthy again and get these implants where they're going to last, ideally a significant amount of time in their mouth. I actually, it's kind of funny because if you go to an orthopedic surgeon and they replace your hip, do they give you, do they say, oh, this is going to last a lifetime? No, they don't. They're like, like 10, 15 years, you may have to get it redone again. It's like, well, yeah, it's a similar material that these implants are made out of. So, you got to really think twice. Is this the patient that it's going to be a good case for? Not every patient is going to be a fantastic case for, an all-on-4 or full arch prosthesis, full arch of implants. You got to figure out, hey, are these teeth savable? I've seen lots of patients come in. They're like, hey, my dentist told me I needed all my teeth out. That's not the case. Either it came from one of these full arch mills, and that's the only treatment that they have. If you've got one hammer in your toolbox, you're going to use the hammer a lot. So it's
that's a big problem. Yeah.
Mm-hmm. It's a big problem. Over treatment
We're seeing
planning.
A lot of that where dentists are just like, I only want full arch. And it's like the patient comes in and needs a hybrid, or they need a denture, or they need something else. And they're like, nope, we only do full arch.
Only do full arch.
It's not a good scenario for the patient.
No, I mean, you really want to have more tools in your bag.
You're not doing what's best for the patient.
Mm-hmm.
Yeah, 100%. Okay, so last question for you. Are you noticing any trends of like where you're helping people from certain scenarios? Let me give you an example. I just heard a scenario where a patient was taken to one of these classes to be operated on by dentists that don't know what they're doing, right? They're learning. Yep. And they went down to South America and they absolutely it was horrible. Or you hear about these patients that go to Mexico and get treatment done. And are you noticing any trends or anything where you're just like, yeah, this was kind of on like the patient, it's coming from these states or these areas or these kinds of practices or these countries. Are you noticing any trends like that?
Yeah. I'm actually kind of glad you mentioned that because I practice in South Florida. So, we're basically the gateway from South America to the rest of the United States. So it's very easy to get down to pretty much anywhere in South America, direct flight from Fort Lauderdale, Miami. It's easy. So we see a lot of patients coming in and they're like, oh, I got this placed in, Costa Rica or, Panama or Colombia or, wherever. It's not to the same standard of care a lot of times. I mean, I don't want to say every single time it looks abysmal, but the ones that at least come into me look pretty darn bad. And there's a lot that could have been done on the surgical and the prosthetic aspect to prevent that. And it's tough. I had a guy who came in like 3-4 weeks after surgery. He got surgery in Costa Rica, came in, everything was infected. Every implant was infected. And I mean, what do you do at that point? Literally 3 weeks in, everything's infected. These implants, I mean, when you go to these third world countries, other places where, I mean, yeah, it's going to be a whole lot cheaper, but they don't factor in the complications. And then this guy, I mean, I told him, I was like, listen, I'll give you some antibiotics, go back down there, see what they can do for you, because the only thing I can do is take them all out and give you basically clean it out, bone graft to give you a denture for a while, rehabilitate, and then, see what we've got left. But it's, people don't factor that in. And I've seen some really, really bad cases coming from overseas. Occasionally I'll see one that happens right here in the US of A, but, a lot more frequently if they come in, they're like, oh yeah, I got this done in Colombia. I'm like, well, I can tell. So, it's one of those where you don't want that. You don't want something where it's pretty obvious it was done below the standard of care in this area. So you don't want that. So If anybody's thinking about that, don't go overseas. Just save your money and just get it done by someone reputable in the United States.
Well, Mark, I've learned a lot just listening to you and the brief conversation that we have. And I think this is really, really important conversation. I know you don't, the best part, the reason I know I can trust everything you're saying, you don't have a pony in the race, right? Yeah. You're just trying to help patients. It's not like you're coming on this podcast to sell me something or sell the audience something.
Nope.
You did this out of your own time to help doctors and the people out here in the full arch world. So you help me. And so I see a really need for for people to learn from this. But more importantly, there's going to be doctors listening to this going, man, maybe I need to pump the brakes on this a little bit, or maybe I need a little bit of additional training. Any closing thoughts on that? I appreciate you coming on, but any closing thoughts or any last words around that topic?
No, I mean, it's definitely very important that you get a lot of training. That is huge. Get as much training as possible. That prevents a lot of this. And maintenance. I mean, I know the local all on mill. They don't even discuss maintenance with their patients. They just do the procedure and then see ya. So you don't want that, because they are going to come back, and they're going to come back with failing implants or failed implants, and the prosthesis is failing. And well, whether or not, you tell them, hey, you should get this cleaned every so often, they blame you. And I like being able to sleep well at night. And what helps me sleep well at night is the ability to say that, I did everything possible to make sure that this case, when I do a full arch case, I make sure that it is done as well as I can possibly do it. And I know that the restoration is going to be done as well as it can possibly be done, to set the patient up for something cleansable, something successful for the long term. Because again, I'm not that old. I plan on doing this for another, 30 years if I can. So I don't want these patients coming back in. It's not like I'm on the tail end of my career where I'm like, see ya. Yeah, no. I want all of my cases to work well. And, when I do them, I make sure that it is done to the best of my ability. I'm not pumping out, 9 arches a day. It's one of those where I like to take my time. I like to do it right. And I think that sets you up for success in the long term. So that would be my recommendation for everybody. Just do it right, because at the end of the day, you know the difference between right and wrong, and cutting corners and not cutting corners. And if you cut corners, yeah, it may last for a little while, but again, long term, they're going to end up seeing me, and then they're not going to be happy about it.
Thank you so much for coming on. I really appreciate it.
You're very welcome. Thanks for having me.